Good evening, everyone, and welcome to Natural Childbirth 101. I am Kaleem Joy. I'm a licensed midwife, a certified pediatric massage therapist, and a certified professional midwife. As we're waiting for everyone to join us tonight, I'm looking forward to sharing a perspective on what normal versus conditions happens to be. So as everybody's joining us tonight, I thought I'd just start out with kind of a little story. In our yard, a handful of years ago, we had this very big, wonderful oak tree. And this oak tree had, I don't know how many years old. And it began to, it had always shaded the yard very lovely. It had, we had tied swings to it for the kids to swing on. We had used the base of it as a background for doing photo shoots. So you can tell how big that base would be. And it provided a lot of just natural beauty, charm to the yard. And we began to realize that this beautiful natural tree that had done so beautiful for so many years was beginning to get hollow, which started telling us that there was problems with the tree. So when there was a problem that happened with the tree, we sought out someone who deals with trees who have problems and who had the tree had a condition, right? So the tree needed attention by someone who dealt with trees that had a condition, and the tree needed to be removed. So bringing that into tonight's live, it's understanding that nature, or our normal part of life, is something that continues on. It is the air that we breathe, which we have done since the moments after we were born. We began to breathe, and when we took a breath, our body began to transition our heart. It began to push fluid out of our lungs and into our vascular system. It began to change everything over so that we became a separate individual, even though we were dependent on our parents to provide for us until we could provide for ourselves. So being able to have a pregnancy, generally, as we've talked about before, if it's by a traditional route or insemination, if parents are needing that, sometimes it's even through in vitro because there's been infertility problems or something that has happened. But once the pregnancy occurs, is the pregnancy now considered normal, a normal part of our life, or is it a condition such as a gallbladder disease, such as toxemia, such as diabetes, or a bladder infection? These are all what we consider conditions, right? What about someone who, say, has had an amputation? Is that a condition? It's something that they still are able to live life, maybe with the support or help of a prosthesis or a prosthetic chair. But the fact is that life still begins within the body, because there's nothing in medical science that we are aware of, although I'm sure they're trying, to create life outside of the body. The body is the only thing that can grow a beautiful little body for this new baby and its whole entire system so that it can come out here in the world and be a person and live and grow and progress, right? So when we look at things from a normal or a natural aspect, we realize that breathing is something that we do every moment of the day. We do it 10 to however many times a minute if we're running or going up or down stairs, and we breathe. Our body automatically does that. It does it because that's part of staying alive. Our body's heart beats because that's its job, and it knows to do that job. Our digestion works. We eat food, it goes in our stomach, we digest food, and things occur, for our bowels and our bladder, right? We get cold, and there's something in our nervous system that says put more clothes on, close down your little skin vessels so that you don't lose heat. We get hot, it opens our vessels, our head lets heat out, our feet lets heat out, and our body gets told to be able to do something different so that we can cool off. These are normal. Our body knows how to do that. The body knows how to compensate and how to work with the normal, natural way that we progress as humans. When it comes to growing a baby inside, the body knows how to do that. Now, getting pregnant for some people can be challenging. I was one of them. I understand this. But let's talk about, as pregnancy has occurred, being able to continue a pregnancy. Now, when pregnancy is normal, pregnancy continues. Your body adapts by making more blood, by breathing more oxygen to oxygenate the baby, by carrying away waste products for the baby. Nothing from outside of you has to do that for you or has to tell you to do that or how to do that. Your body does that on its own. So that's where it is normal, it is natural, and that is regardless of our religious or spiritual beliefs, rather whatever color skin we have, whatever ethnicity we are, no matter where we live, no matter what our economic bracket is. The same thing occurs for every single person who is pregnant. Now, birth is the same. The body created the way for the baby to grow inside. It has a way to get the baby out. So it knows to continue to listen to the baby, help the baby grow, and at a point in time, which is said to be 40 magical weeks, give or take a few, right? 37 to 42, wherever that fits. And the baby says, I'm ripening up. I've got my lungs ripe, I've got my body ripe, my neurosystem is ripe, and I am now ready to leave the inside womb home and come out to the outside womb home, which is in your arms and nursing or bottle feeding if that's what needs to happen, but in that nurturing space, right? And so the body created the way, and so did the baby, for being able to transition that. The body knows to go into labor. The baby knows to go into labor. The body knows that it has to contract, or the muscle of the uterus has to get smaller, and that's what those wonderful expansions of the cervix and making the uterus get smaller, it balls it up to the top, where then it helps to push the baby out, because the body and the baby both know it's time for the baby to be born. All of that occurs. The timing of those wonderful contractions occurs on time. No one has to tell your body. You don't have to tell your body, it's time to contract, it's time to stop, it's time to contract, it's time to stop. Your body knows how to do this. So when does things shift? All right, baby comes out. Baby has an instinctual desire to get to breast. That's their goal. A parent has an instinctual desire to get baby there. And the body wants to make milk. Now that's regardless of whether you make a lot of milk, perfect amount of milk, or a small amount of milk, or no milk. All of that still happens. The baby still wants to root and go to breast. You still want to root and put your baby to breast. Eventually, the baby needs nourishment. It either comes from within, or it comes from without, or it comes from both. Either way, everything still goes along in that rhythm. All of that is normal, was placed in you, was placed in every parent's body, and that occurs. So where does it change from normal and natural into a condition? So a condition is something that is abnormal that's happening. That would be, there's a rash. Something abnormal is going on. There's a condition happening, right? There could be, you get a cold. There's a condition, or an illness, or a dis-ease, D-I-S/ease. There's something not going quite well. There's a condition. Somebody gets a gallbladder attack because the gallbladder is not working well, pregnancy or not, okay? It becomes a condition, and the condition means that something is not normal or natural at that point. It's not functioning correctly, and it needs to have care. So maybe you do something that you throw your back out. There's a condition. You're having a condition of something that is not working well for the body. So what do? Maybe you seek a chiropractor, a massage therapist, an acupuncturist. Maybe you go to an orthopedic. Maybe you go to a family practice doctor, depending on what the condition happens to be, right? Let's say the condition for someone who gets aged is cataracts in their eyes. They're going to go see an eye surgeon, and they're going to have that condition taken care of, whether that's by surgery or by medication or by therapies. If somebody has injured, maybe they've fallen and injured themselves, whether they're in sports, whether they're in any number of things, and they go to a physical therapist, or they're going to go do hydrotherapy. They're doing it to bring that condition out of abnormality and back to normal. So, what is the difference between midwifery care and obstetrical care? And I really want to encourage you, regardless of the care that you normally get for your maternity care or for your health care, that you take a look and just let this kind of digest into you, so that no matter who you choose for care, you use the care appropriately. Either way, all right? So, conditions. Conditions are when something goes out of normal in the body and something needs to have attention given to it. Like I said, whether that's herbs, homeopathy, a chiropractor, massage, essential oils, or whether it needs a surgeon and medications. Whatever it is, however it needs to be treated, something's outside of normal, natural, that you want to bring it back into normal, right? Hopefully everybody's with me on this thought process. All right. So when something goes out of normal, and let's bring it into our day-to-day life, like somebody's broken a leg, right? You want to bring it back into normal. Bringing it back into normal means that you want the leg to set, re-heal, get strong, and then the body that's been compensating for that has to be brought back into normal too. Okay? Now let's take it to maternity care. So maternity care is viewed differently in the different practitioners that people see. Seeing a midwife, pregnancy and birth, is viewed as normal and natural. When there's a condition that occurs, such as the common cold, such as constipation, such as leg cramps, all these things, it is looked at, and a midwife will say, with natural means, how can I tell the person who's pregnant how to bring it back into normalcy to keep the body normal? Diet, exercise, stretches, again, going and see alternative care practitioners. When it is something such as symptoms of high blood pressure, some swelling, perhaps some itching, this condition, if it cannot be brought back to normal, then is a condition that gets referred to the specialists who deal with higher risk conditions, such as toxemia, diabetes, cholestasis, and so forth in maternity care. And so an obstetrician is really, really, really good at being able to use testing, medications, and surgery to deal with conditions. That's where they go to medical school. They go to medical school to learn about the entire body and how certain conditions, maybe it's hyperthyroidism that this person has who is now pregnant. How does it affect the pregnancy? Does it need more monitoring and surveillance to make sure that the baby does well? Is there a condition that needs that high-risk care versus the low-risk help with that condition? And that's where the questions come in. Now, there's still perspective to that, because in alternative care, you've got a lot of options to bringing the condition into normalcy enough with working with normal pregnancy and birth to be able to continue forward. A midwife knows how to assess when it is outside of what's appropriate for midwifery care anymore. People often wonder about this, but is it safe? Is it safe? Yes, it's safe. And why is it safe? Because they know how to assess that, right? Right on. Thanks, Erin. So a condition, right? When we look at going through our normal, natural pregnancies and births under the care of providers who deal with conditions, pregnancy is considered by their definition as a condition. And so it is treated as such, as a condition, an illness. It's not, but as a condition or something that has to be monitored in a way that it could break. It could fail. It may not work. Whereas in midwifery care, you're going to be looked at as, of course it works. It does well. It's meant to work. Why? Because your body was meant to work. Now, I know and you know that there are situations when natural and normal didn't pan out. And I know that occurs because I've seen it myself. I've seen it in my practice before, when there are times when that happens. But what I've learned so much about is that there's so many ways to help keep normal normal, so that the progression of the pregnancy, the progression of birth, the progression of postpartum, the baby, the breastfeeding, the whole bit has the best chance of staying within the parameters of natural and normal or slight variations. Now, many times I am told all different kinds of stories. And as we've talked about in previous lives, so many people have stories, and some of those stories can be really challenging stories. Let me just see what one person has asked. Oh, that's a really good question. Thank you so much for asking that. So, what is the best way of explaining to your partner and family about the reason that you might want to have midwifery care or a home delivery? So, our families ask us that a lot because it is looked at as being so outside of what the norm is, which I understand percentage-wise it sure is, but it shouldn't be. This should be more of the norm, right? We get it. So how I share with families of how to explain being able to do that is first by saying, what has your experience been? Now, case in point, we had a family member, and a family member's partner, his family had only had children through cesarean sections, and they were all premature. So when we sat and we talked to them, we said, your situation at having babies in 32 and 33 weekers and having problems in the pregnancy warranted needing to have higher intervention, care, and deliveries. You're right. That was important. But we need to look at the difference in this particular pregnancy for this family member who is not having problems with the pregnancy, who is carrying to full term, who comes from a genetic line of being able to have fast and easy births, and look at that as its own story and book, because family members often are bringing their story into your story. And the first thing that has to happen is you have to validate to them that their story was realistic and that they understand. The next thing is say, I need you to read. My favorite one is Ina May's Guide to Childbirth in 2019. It's been one that I've recommended for the last several years. It tells a lot of perspective, and remember that older family members may not have had the knowledge that you are gaining by your choice to listen to more natural-minded providers, okay? With partners, it's very key that they begin to understand that they are the protectors and the providers. They want to protect you from anything that should bring harm to you or the baby. So why in the world wouldn't you want to be in the best high-tech hospital with the best high-tech doctors that you can handle? Because often that's not going to give you a better birth unless there are significant risk factors that you need that technology to keep things safe. So looking at the difference between natural and conditions, in the medical world, pregnancy is looked at as a condition, as that it will break, something may go wrong, and that we need to be really, really hands-on with it all and use a lot of technology to make sure that it's okay. What we know, and the more you could read and gain insight on how oxytocin works. Dr. Michel Audant, he's a fantastic writer. He's written several books. He's a very easy person to find on the internet as well as in literature. He explains from a very scientific as well as a psychosocial the importance of oxytocin and the importance of privacy and the importance of less technology, not more. And so gaining that understanding and giving that to friends, to family, to your partner is saying, please educate yourself before you start feeling like the choice that I want is a bad choice, that it's an unsafe choice, that it's something that I shouldn't do. Because the reality is, if that were the case, then all the babies that we had born at home and the parents, things would be very, very different. Now, in my personal practice with my partner, Marlene, our practice of 21 years, we've had approximately a 2% cesarean rate, okay? So something we're doing that is really something our families are doing, right? I don't deliver babies. I can't make a baby. I'm not doing any of that. But what am I doing? I'm educating. I'm educating families that already know that they want to trust this process because they've learned enough, their heart knows enough to realize that something is right and that there's nothing wrong with a hospital. There's nothing wrong with technology. There's nothing wrong with obstetricians. They're wonderful. What we do see is too much technology in birth. And what we know statistically, anywhere that's out there, is that it's not improving the outcome. When the outcome can be improved, and improved doesn't mean that there's a baby that's alive. Everybody wants that. From home birth on up, everybody wants the same goal. But what it does improve is how the birth, how the pregnancy occurs. Because we know that nutrition is a key element. We know that supplements can be a support. We know that getting that pelvis, as I've talked about numerous times, the fluidity of the pelvis and the ability for the pelvis to open and all of the uterine muscles to work well. When those things are all in alignment, everything goes. Birth just happens. And whoever's there with you is really there to be a support, a good setup and cleanup crew, because they're not doing the job. You are. And you can do it. Now, I hear so many stories that come through, and I know all of you have heard stories of my baby would have had I not been in the hospital, right? Now, I can't tell you whether that's true or whether it's not true. I can tell you that I have listened to hundreds of stories where if we wind back the clocks, then we needed more education to that family member, that parent, to be able to, right on, Kelly, to be able to give them the tools to be able to help their body be able to handle the pregnancy, prepare for being able, I'm repeating myself, to prepare for handling birth, going through birth smoothly, and having a good postpartum. That's the essential bottom line here. You need the education. Everybody does. What if nobody had any of that education and they were birthing and they were going through their pregnancy and birthing without any care provider? The vast majority of the time, and I know you don't want me to say this, but the vast majority of the time, things go well. So what do you need me for, right? What am I any good for? What are prenatals any good for? What's having somebody at your birth? What's all the technology there for if it's all going to happen anyway? Because sometimes things come up. Sometimes I feel a baby that I'm worried about because it's too small or the water's too small or something's not going right. So what do? I'm going to give this parent the tools to eat more, rest more, drink more. Let's see if it corrects it. We're going to find an ultrasound to see, do we need to refer out because now there's a condition that needs that higher scale. You don't go to a hospital every time you have a hangnail. You take care of it. You don't go to the hospital every time you are constipated or that you have a bladder infection. Well, maybe you do. Maybe you go for antibiotics every time. I don't know. I don't. I have other ways I can handle it. Hopefully, if that's not working, then we go to the bigger scales and we go to the antibiotics. In other words, there's a chain of command, and if you aren't familiar with this, or you have other people in your life that aren't familiar with this, express to them that you get where they're coming from, that they're used to these things that are medical conditions and how they're treated, and that this is really new. So because it's really new, that means there's things to learn about it. So you hand them a book, you ask them to learn, you ask them to go to talk to a midwife and find out about what that care is, because people think that we as midwives go to a birth and we have nothing with us. Because many times people think that we are doulas. I love doulas. They're great educational support. Okay, I'm watching one doula on Instagram lately, and I thought, wow, she is a great educator. She's got really great ways to talk to people. I'm really proud of her. And I know that it's sometimes, if I have someone in, that the care about helping to solve it, instead of just saying this is what it is and this is all we can do, is what keeps the pregnancy coming back to normal, keeping the conditions away, and allowing to go forward into normal birth. During birth, yes, I listen to the baby. Why? Because I want to make sure that the baby isn't telling me something that it needs more help. It's super simple. And you support a woman in doing the job that she knows how to do. She knows how to do that. Sometimes you rub her back. Sometimes you encourage her that she can keep going because she just needs that encouragement. Sometimes you get up and you get those hips spinning because something's going on with the baby's head that just needs to rotate. Those hips moving, that head shifts and can find its way through. Now, when it doesn't, and that does happen sometimes, it does. I know it does. That's when we go and we have more intervention to help the baby come safely. It's not an either or, and there's no way you're going to do the other. It's called start with what's normal. You breathe every day, you pee, you hopefully poop every day. You sneeze when your nose gets tingly. You have sex. You have breaths. You have more breaths when you go up and down stairs. Your body grows a baby. There's a condition that they talk about, an incompetent cervix. That means that the cervix isn't able to hold the baby in. It's a condition. Guess who needs to take care of that? The docs are great at that until maybe 37 or 38 weeks, and the baby can come if it wants to come at home, right? That can happen because now the baby can come out. So there's not an absolute. Sometimes there's a mix, an integration. But we have to remember what's normal and natural and what's a condition. All right, you ready to feed me off some more questions? Yep, everybody's coming in. Excellent. There's one. Let's see what we got. My sister had 2 emergency C-sections very early. Does that mean I'm more likely to? Would a home birth still be safe for me? So remember my story book, right? Every person has their own book. Every baby, every pregnancy, every birth has its own book. And no 2 are exactly the same. So your sister, who had 2 emergency cesareans, one, when they call it an emergency cesarean, when I think of an emergency cesarean, it's something where the baby crashed as far as their heart rate went down, they were rushed in, they were put out, and the baby was out within 7 minutes, okay? They call it an emergency sometimes because the baby's not doing well and they need to go in more quickly. They don't get to just sit around and say, well, it's not working, let's do a cesarean, and take their time, and it's 30 minutes, 40 minutes, or it's whenever the doc can get there. I get that. Having had 2, it says, why? And that's what I can't answer without knowing what the story was. That's giving you some perspective. Was she induced? Did she have Pitocin drip? Did she have an epidural? If she was on an epidural, how long did she push? Did they turn the epidural down and allow her to push? Did they break her water at 4 or 6 centimeters? Did the baby have a nuchal cord? If the baby had a nuchal cord and they broke her water and the baby didn't like it and she was on an epidural and on Pitocin, the baby may have been too tired because she wasn't breathing deeply like normal labor would breathe to oxygenate the baby. The baby gets tired, so then it can't handle pushing, and so then the baby crashes and they have to get the baby out. So we have to be able to understand that technology's sequelae sometimes sets up the potential of the exact thing that my baby would have or I would have had I not been in the hospital. But you got to go back to where did it start, okay? Now, if it was a normal natural labor with no interventions with the exception of being in the hospital and being on monitors, that is a small intervention, meaning that you can feel like you can't move or they restricted her to bed or whatever was going on, but there was no other medications in the birth, then that one is a good question. Why did it occur? If there was no breaking of water broke on its own, if there was no medications, there was no other interventions, then why did it occur? And that's a question I can't answer without knowing the story, right? But what I can say to you is, because your sister had them, your mind has to be able to segment that those were her stories and not your stories. Because if you take that and say, oh, maybe that's what's going to happen to me, then you've already started out in a pregnancy with fear that that's what's going to happen. And that is part of, I would say 50%, if not more, of making sure that the body is doing what it needs to do so that baby and passageway and power are working well, but that the mind is the other part. Because when you look at how oxytocin works, if fear is going on in us during the time that oxytocin is trying to bring a baby out under love, the two are fighting each other. And the muscle fibers in the uterus clamp down instead of allowing it to open when adrenaline is flowing from fear. So when we can eliminate the fear and bring in the trust and allow our bodies to do what they need to do, provided you get a baby in a good position, because the baby has to do its part, you are there as a team, then things go well. And when the little mind chatter comes up, you say, thank you for sharing with me. I'm going to stay in my body, in my bubble, and I will talk to you about that fear after I'm done. Because that's where the fear of other people come in. Their fears, especially if they're there at the birth and they've got that worried look on their face. Oh, and you look at them, you're like, what's wrong? Is there something wrong? Something wrong with what happened, right? You can't deal with that. Going through labor, you need only happy people, people that are looking at you and saying, you can do this, just keep going. You're doing a great job. Your body is strong and you are so strong and your baby is so strong. Just keep going. That's what you need, right? If you're out running a marathon and people are looking at you like, wow, that was really hard. I'll bet you're getting sweaty and hot and tired. Are you sure you can go on? I don't know if you can handle this. That was really hard. Yeah, okay. And I know some of you have experienced this or you've heard about it. And you can't experience it from a partner either. You can't, when you are in labor, hold someone else's fear, doubts, and worries up. If that's where they're going to be, they've got to go someplace else, okay? And partners are the same way. They cannot rescue you. They should not be expected to, and they need to understand they are there to support and keep telling you you're doing a good job, no matter what's going on inside them. All right, let's see. What other questions are coming up? Getting lots of waves. Thank you, everybody, for joining me. I love it. Uh-oh, what did I do? Uh-oh, I turned my camera around. No. All right, no, let's see. Tabbing a photo. No, keep going. All right, somebody help me. I need Aaron. That's who I need. Nope. Oh, I'm so silly. Let's try. Hey, yay, I figured it out. All right, more questions. Oh, technology, I love it. Tried to birth in a birthing center with a midwife, ended up getting high blood pressure and had to be induced. Any recommendations for my pregnancy to help the blood pressure? Yes, I love that one. All right. Being able to make sure that you eat protein. Protein from the time that your tummy will tolerate it, all right? So as soon after that 12 weeks and your tummy starts to settle, you must eat protein, protein, protein. Good quality protein. That can be nuts, nut butters, can be lentils, beans. Beans are great for morning sickness for some women, by the way. That's eating meats, chicken, fish, eggs. Cheese is not considered protein. It's really considered calcium in our book. But Greek yogurt, cottage cheese, those have protein in them. So eating protein, 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 because you want that blood volume to build. When the blood volume builds, that's one of the best things for keeping that blood pressure down. Also, taking magnesium, 400 milligrams of magnesium every night before bed. Sometimes you have to take 800 if your blood pressure is a little marginal. We use an herb called passion flower. It's very helpful for keeping the blood pressures under control. So look that up, see what that looks like for you. And being able to use CoQ10 enzyme has been helpful too. CoQ10 enzyme, somebody liked that one, is in every cell of your body. It helps the hydrogen and the oxygen to and make energy. Well, it not only helps with energy, but it also helps with collagen, and collagen is the elasticity in your body. So when you have good vitamin C, protein, and CoQ10, collagen, which is part of your blood vessels because they have to expand and contract, collagen helps them to be more flexible, okay? So those are some things that I would recommend. Also being able to not get white coat anxiety every time they take your blood pressure. Sometimes having a cuff at home and taking some readings at home is also helpful so that you kind of know what's normal for you. And what's told in our midwifery is that it would be a high blood pressure, which is 15 points above your normal. And the magic number is 140/90, right? That is 2 readings 6 hours apart. So keep that in mind also. But a birth center sometimes has protocols that they have to stay within parameters and they can't go outside of those parameters, whereas home birth has a little more wiggle room in it, depending on what state and area that you live. Those are the best keys, and the one important supplement that we use across the board is dandelion. We have had so little of elevated blood pressures in this practice, and I have never in all of the babies had to refer somebody out in 21 years for blood pressure issues. Okay? Everybody takes dandelion leaf if you can find it. Most of the time you can find dandelion root. They take 1 capsule for every 2 months that they are pregnant. If they have blood pressure issues, we add 2 or 3, sometimes even doubling that. That's our favorite for everybody. It balances sodium, potassium in the body, and it nourishes the liver. And the liver has to work really hard in pregnancy in order to filtrate all of that excess blood and all of those hormones. So dandelion does a great job of helping them with that. So we have everybody on it because it just seems to do the best job. So dandelion is our favorite. Add to that passion flower. If you have a tendency to have high blood pressure, make sure you're taking the magnesium. And CoQ10 is another option. How much CoQ10? I recommend up to 400 milligrams if you can a day. CoQ10 can be a little pricier of a supplement, but you can't overdose on it. We know that. They've used it in multiple conditions to help with things, and there's no toxicity without taking really billions of milligrams of it, so it's very safe and very useful in your body. Okay, hopefully, I do love questions. Very, very lovely. I don't know how I managed last time to turn myself around. All right, here's another question. I had complete placenta preview with my second daughter, was on bed rest for bleeding for a month in the hospital and delivered her via C-section at 33 weeks, 5 days due to my water breaking early. All right, there's a condition. Thank you. A placenta previa means that if you have the cervix, and we'll go this way, you have the cervix, right, that's going to open, but the placenta is over the cervix. And as the cervix starts to dilate, you can see that's not going to be a good thing because the placenta has to have the wall of the uterus in order to transfer blood between the birth giver and the baby into the cord, right? And so when the placenta is over the cervix and the cervix starts to dilate, it starts getting bleeding from the placenta, and obviously if it were to continue, the placenta would try and come out before the baby, and then the baby's in trouble, and that just doesn't work. So having a cesarean is what needs to happen. And so in your circumstance, especially with your water breaking, was it a complete previa, I wonder, or was it a marginal? But nonetheless, you were having issues with it, and yours was an appropriate use of technology. Fantastic. You are what the World Health Organization said there should be no more than 10% of interventive and cesarean births. And in our nation, we have a minimum of 33%. So 1 in 3 women are going to get a cesarean. In your case, this was an appropriate cesarean, a reason that we have hospitals, monitors, and cesareans, because in days past, in 200 years ago, that would not have worked, right? Today we have an ability to keep you safe, to keep your baby safe, and to deliver the baby so that both mom and baby are healthy and well. It's not something we would do at home or in a birth center. It would be inappropriate. As soon as you started bleeding, we'd go find out there's a previa there, and that would be either on bed rest at home or you would be monitored in the hospital and you would have a cesarean. I have had one family who had a complete previa like that, and similar story. She went, I think, to 36 or 37 weeks. All right, will it happen again? Not necessarily. Those placentas attach anywhere they want to, and it's less likely that they're going to attach low like that. The percentages are much less. All right, let's see. More questions. How can I differentiate between a condition or just a pregnancy symptom? Ooh, good one. For instance, swollen, tender, varicose veins. All right, so varicose veins would be something that is unique to you, and a varicose vein becomes a condition that is not manageable under normal care, all right? Because there are certain small little bits of conditions that are manageable under normal care, keeping things within normal. Now, a varicose vein is an expanded blood vessel that sometimes you can get a lot of little spider veins all over your calves, sometimes behind your knees, right? And some birth givers can get a varicose vein in their labia, down their legs. So when it becomes a problem is if it becomes hot, warm, or hard, right? And when there's significant of them, you should be checked out by a vascular surgeon and have them take a look and say, you know what? These are pretty superficial. I don't think that these are going to affect, as long as there's not any clots or heat. In other words, that there's not a stagnation in there that becomes a problem. I've had women have to wear support hose before in order to keep those under control, because as that blood volume expands, those varicose veins get worse. And I've seen some pretty good ones, and they've still had midwifery care, and they've still gone on to have home births, and as soon as their babies are born, those vessels start retracting very quickly because the blood volume settles down and the pressure from the baby is not there. Some have had to wear little support panties, like I said, support hose, in order to keep the vessel having some help so that it doesn't keep bulging out and allowing itself to get bigger. Hopefully that makes sense. So differentiating between a condition or just a pregnancy symptom was a really good question. Varicose veins is not just a pregnancy symptom. That's a slight condition, but it's very manageable within normal. But it didn't go into a condition that is warranting medical help, right? Just the same way as if you get a snotty nose. You get a cold, that's a condition. You got a condition going on, but it heals up on its own and you're able to manage it, okay? Same way with that, as long as it doesn't branch over. A little bit of elevated blood pressure, it's all good, unless it goes to a point that it's not able to be brought back to norm and managed during the pregnancy. This is where care providers come in when there are things like this, so that things don't get worse, giving you the tools to know how to help and handle it. That CoQ10 I mentioned about, arnica cream, rutin, A supplement that has a lot of antioxidants in it can really help those varicose veins. All right, let's see what other questions we got going here. You guys are so good at this. I just love it. I had no complications with my first baby and had a vaginal vaginal birth. What are my risks for future babies? Is placenta previa likely again or an early water rupture? So when you had no complication with your first baby, okay. The likelihood is as likely as any baby. There's not a correlation, okay, that if you had one baby that had a previa that you're going to have another one. It just happened to be that when the egg got fertilized, sometimes they should be up in the fallopian tubes when they're fertilized. When the egg came down, it got all the way to the bottom when it decided to burrow and implant and grow. Most of them burrow and implant up higher because they come in from the fallopian tubes, they kind of fall into that, and they burrow in. So your likelihood is you know, as wide ranged as how that happened for you the first time. You will have a VBAC this time. So that one brings a different set of things to have to work with, all right? As far as where you're planning to give birth and who your care provider is, what your facility or home, depending on where you would want to give birth, and what their protocols are on having a vaginal birth after cesarean. What I want you to know is I've done a live on VBACs. Please go watch it if you haven't before. It's on my Facebook account, Natural Childbirth 101, and it'll say VBAC. Being able to understand how to work with that is more the important part, because you're going to be able to have a completely natural, a non-complicated birth like you did with your first. However, the scar sometimes makes the front part of the cervix a little lazy, and you need to know that if it comes up in the last part of labor before pushing. If you get real pushy but there's a little lip of cervix, you need to roll over in your hands and knees, roll back, do that for about 30-45 minutes, and then have somebody push that lip back if it's a little lazy, because that nerve endings in the front may not cause it to pull back. It's not hard to do, okay? But when it happens, don't let that become the reason for another cesarean, because it doesn't need to be. All right, as far as water breaking early, that one, no. There's probably a likelihood, and I don't know, was the baby breech or head down, but it's more a likelihood that there was pressure going on from the placenta that was causing more of the early labor and the baby, and the water broke. But it doesn't mean anything that your water will break early at all with the next baby. That again, remember that sac and the placenta are specifically unique to the baby who made it. And that's something to really remember when you have circumstances like that. When you have cords or anything like that, these are unique to the baby. It's as unique as your baby's skin was made, is their own bag, their own placenta, their body, because it's a part of them. And so it has nothing to do with what goes on in your uterus. The only time that it has a relevance to that is if there is some abnormality of the uterus, okay? And that's not from what I can understand what would be your case, meaning a uterus that had like a septum in the middle. That can be a different story where it's almost two uteruses. And yes, that does happen. All right, let's see. When was the writer who was the writer that I mentioned about the oxytocin? His name was it still is, Dr. Michel Odent, O-D-E-N-T, and he practiced in Pithiviers, France. He tours around at most of the birth conferences for many years, and he's quite old now, but Michel Odent. And Michel, I think, is spelled Michel, okay? I don't think it's spelled Michael. I have a book on a couple of his books, but he's written many books. but Michel Odant. You look him up, you're going to find him. He's got plenty of references out there. All right, let's see here. All right, keep your questions coming in, and hopefully I'll have answers that will give you something. Tips for VBAC. I had my first in the hospital with a midwife and ended up with the classic cascade of interventions and a C-section, hoping for a home VBAC. That's called an HBAC, by the way, for number 2. All right, so please do go watch my VBAC one. I talk a lot about that, and it has a lot to do with making sure that there are things that are going smoothly in the pregnancy so that you don't need an induction, or that there aren't problems, going on in the birth because of what happened in the pregnancy. And a lot of it has to do with those P's, right? It's the passenger, which is the baby, that the baby has a tucked chin, back up front, nice and well engaged in your pelvis, that the pelvis or the passageway is fluid and flexible, which means my recommendation is you get on a birth ball and you salsa dance, okay? Lots of big figure eights back and forth, and you do this as early in the pregnancy as you can, all the way through, but especially in the 3rd trimester. And getting to a chiropractor and or a massage therapist to make sure that there's not anything in there that's kind of locked up, especially if you've already had to have an interventive birth and you've had a cesarean. You want to be able to make sure that you have the maximum opportunity to have the passenger, the passageway, which those two will then help the power, or that lovely oxytocin, to work really good. And the power has a lot to do with what goes on up here and in here. And we talked just a few minutes ago about oxytocin and adrenaline. And oxytocin helps the body to open and cause the uterus to contract and gather up in the top and push the baby out. And in order to have good oxytocin, you need some privacy, you need quietness, you can have, some music or people giving you positive encouragement, but you don't need people asking you questions, because questions are in your thinking brain. Back here is in your primal brain, which is where oxytocin works, things you don't have to think about. And you want that nervous system to feel really calm and relaxed and really able to own what you're feeling and accept those things. When things start coming at you, you get in conflict. That means adrenaline starts coming up because you need to protect yourself. When adrenaline comes up, the uterus can't contract quite the same, and it causes the uterus, the cervix, to want to stay closed. And when it does that, it also stimulates adrenaline, which makes adrenaline contractions, which are short and sharp, and it makes you panicky, and it makes you, breathe fast and you're like, I need an epidural, I can't handle this anymore. So that's where you get in the shower, you get in the bath, because we know that brings the nervous system back into normalcy. The biggest thing is making sure that you put yourself in a beautiful pink bubble and that you have lots of love and support. And having a VBAC is awesome. Having an HBAC, awesome. Just remember about that little cervical lip that I was just talking about, because that can cause a little bit of delay right there at the end, okay? And it just means if you know it ahead of time, you just change positions a few times, give it another hour, and then ask somebody to hold it back while you push past it. That does not feel good, but it's about 2 pushes of getting it past, and then the baby comes out. And when you've had a cesarean before, you're okay with that. Okay? All right, let's see. What else have we got here? Oh, I did it again. Let's try that, how that gets happening. Must push a button someplace. All right. Do we have any more? There's some questions on my Facebook. Fabulous. What are your other basic recommendations for every pregnant person? Supplements, I mean. So we always recommend, you mentioned dandelion for everyone, so just wondering if there is anything else that goes along with that. Also, if you have time, I have horrible morning sickness every time. Oh, I'm so sorry. Okay, all right, I will conquer that. So on our list, thank you. On our list, we do methylfolate, okay, making sure that it's methylfolate because then the methylation is easier for the body to metabolize. Methylfolate of 800 to 1,000 micrograms. The dandelion, which is one for every dandelion root,